Bone grafting is a vital procedure in modern medicine and dentistry, especially for repairing bone defects or supporting dental implants. But what exactly makes a bone graft material ideal? In this video, we'll explore the essential requirements for bone graft materials, the challenges in meeting these standards, and the clinical techniques involved. We'll also discuss intraoral autografts, their sources, and why they are often preferred. Let's begin by understanding the core requirements that define an ideal bone graft material. The first and foremost requirement for any bone graft material is biologic acceptability. This means the material should not provoke an immune response or cause any adverse reactions in the patient. The body should recognize the graft as safe, allowing it to integrate seamlessly with the host tissue. Biologic acceptability ensures that the healing process proceeds smoothly and reduces the risk of complications, making it a critical factor in the success of bone grafting procedures. Predictability is another key requirement for bone graft materials. Clinicians need to be confident that the material will perform as expected, leading to consistent and reliable results. Predictable outcomes help in planning treatment and managing patient expectations. This means the graft should consistently support bone regeneration and not vary widely in its effectiveness from one case to another. Clinical feasibility refers to how practical and easy it is to use the bone graft material during surgery. The material should be easy to handle, shape, and place into the defect site. It should also be compatible with standard surgical techniques and not require overly complex procedures. This ensures that the graft can be used efficiently in a variety of clinical situations, benefiting both the surgeon and the patient. An ideal bone graft material should minimize post-operative hazards. This means reducing the risk of infection, inflammation, or other complications after the surgery. The material should not introduce toxins or harmful substances into the body. By minimizing these hazards, the patient's recovery is smoother, and the chances of graft failure are significantly reduced. Sequelae refer to the after effects or secondary consequences following a surgical procedure. For bone grafts, it's important that the material does not cause significant pain, swelling, or long-term issues. The goal is to ensure that patients experience minimal discomfort and can return to normal activities as soon as possible. This enhances patient satisfaction and overall treatment success. Patient acceptance is crucial for the success of any bone graft procedure. The material should not cause discomfort or be rejected by the patient. Factors such as taste, texture, and the psychological impact of the graft material can influence acceptance. When patients are comfortable with the procedure and the material used, they are more likely to follow post-operative care instructions and achieve better outcomes. Despite ongoing research and development, no bone graft material has been created that fulfills all the ideal requirements. Each material has its strengths and limitations, and clinicians must choose the best option based on the specific clinical scenario. This reality drives the continuous search for better materials and techniques in bone grafting. Once a bone graft is placed, it can have several effects. Sometimes, the graft may show no significant effect, acting merely as a filler. In other cases, it may serve as a scaffold, supporting the host's natural bone to grow and fill the defect. The effectiveness of the graft depends on its properties and how well it interacts with the surrounding tissue. A common role of bone grafts is to act as a scaffolding material. This means the graft provides a framework for the patient's own bone cells to grow and regenerate new bone tissue. The scaffold supports the healing process and gradually becomes integrated with the host bone, eventually being replaced by natural bone over time. Some bone graft materials can actively induce bone formation. These materials contain biological signals or factors that stimulate the host cells to produce new bone. This property, known as osteoinduction, is highly desirable because it enhances the healing process and leads to more robust bone regeneration. In some cases, the bone graft material itself can deposit new bone in the defect. This process, called osteogenesis, occurs when the graft contains living bone cells capable of forming new bone tissue. Osteogenic grafts are particularly valuable in situations where rapid and substantial bone formation is needed. The success of a bone graft also depends on the surgical technique used. Proper preparation and placement are essential for optimal results. Let's look at the key steps involved in the grafting technique, starting with presurgical procedures and moving through to post-operative care. Before performing a bone graft, presurgical scaling is often necessary to remove plaque and calculus from the teeth and surrounding tissues. This helps reduce the risk of infection and creates a clean environment for the graft. In some cases, occlusal adjustment may also be needed to ensure proper alignment and stability of the teeth. To place the bone graft, the surgeon must expose the defect site. This is typically done using a full-thickness flap, which involves lifting the gum tissue to reveal the underlying bone. Proper exposure is crucial for accurate placement of the graft and successful healing. The papilla preservation flap is a specialized technique used to cover the interdental area after graft placement. This approach helps maintain the gum tissue between teeth, providing complete coverage and better aesthetic outcomes. It is especially useful in areas where appearance is important and where maintaining tissue integrity is critical. After the graft is placed, the flap is sutured to ensure complete coverage of the defect. Proper suturing helps protect the graft, promotes healing, and reduces the risk of exposure or infection. The goal is to create a stable environment that supports the integration of the graft material. The use of antibiotics after bone grafting is generally recommended to prevent infection. Antibiotics help control bacterial growth and support the healing process. The choice and duration of antibiotic therapy depend on the patient's health and the complexity of the procedure. An intraoral autograft involves transferring tissue from one area of the mouth to another within the same individual. This approach eliminates the risk of immune rejection and is often considered the gold standard for bone grafting. Let's explore the sources and advantages of intraoral autografts. There are several sources for intraoral autografts. These include healing extraction wounds, bone from edentulous ridges, immature bone removed during osteoplasty and ostectomy, and bone harvested from predetermined sites like tori and the symphysis. Each source offers unique advantages depending on the clinical situation and the amount of bone needed. Autografts are highly valued because they contain living bone cells and natural growth factors, promoting rapid and effective bone regeneration. Since the tissue comes from the same individual, there is no risk of immune rejection or disease transmission. This makes autografts the preferred choice in many clinical scenarios, despite the need for an additional surgical site.